All right, Chad Hasty Show, News Talk, KFYO. Thank you very much for tuning in today. Our next guest on the phones this morning, the Chancellor of the Texas Tech University System, Dr. Ted Mitchell, joining us on the program this morning. And welcome to the show, Chancellor. How are you today?
Doing very well. A little bit busy these days, but everything's going well, Chad. Thanks for having me.
Absolutely. Let's first talk about the memo that your office sent out yesterday, the Phase 4, I guess, for Texas Tech. And is this for just Texas Tech University, for the whole system? And what goes into the decision-making as far as closing down a campus?
Let me tell you something. This is, if you ask people across the country, we're in a bit of uncharted territory with this. What we made the decision to do, though, since we were moving classes online for the remainder of the semester, and this is at all four of the universities in the Texas Tech system. So that's Texas Tech University, Texas Tech University Health Sciences Center, Texas Tech University Health Science Center El Paso, and Angelo State University. Since we were moving to an online delivery, given the fact that the number of cases here in Lubbock County have been picking up over time, we went ahead and moved to what we call Phase 4. And basically what this is just saying we don't want anybody up here other than the essential personnel that we need to do the things like secure the buildings, work through to make sure that the students that we do have on campus that can't go home, that we have folks up here to take care of them. So just truly the essential things that we need to have, and everybody else can work from home. And it's actually worked out very well.
How many or what percentage of students are still on campus? Do you have those figures?
Yeah, if you look at it right now, we have total close to 500 students that are still on campus, and that sounds like a lot, but keep in mind that we actually, generally speaking, during this semester, we'd have about 9,000 students on campus. So it's actually a small number of students. And the students that we do have on campus, we actually have students from the foster program that actually, they left the foster system. They're now enrolled at Texas Tech. They don't have a home to go to, so this is their home. We have students, some of our student athletes would have a difficult time getting home because they live far away. They would be here. We have some students that are actually here. They're from other places, but they're here in Lubbock working, so they're still working at their jobs, those that still have a job. So the group that we do have here are, generally speaking, students that need to be here because either it's hard for them to get home or they've got another reason to be here in Lubbock.
Have students been allowed to pick up their stuff, or do y'all want them to hold off on that? How's that all working?
That's an interesting question, Chad. We have our students lined up to come down and start cleaning out their dorms. Now that we're trying to limit more because of the governor's proclamation to have everybody travel as minimally as possible, we're trying to schedule it so that the students can come down in an orderly fashion with their families, whether it's from Dallas or Houston, wherever it might be, and pick up their belongings from the dormitories. But keep in mind that given the fact that Dallas County, for example, is on a shelter-in-place order, they don't want folks trying to leave there to come out here and go back. So we're trying to do this in a way that the folks that can get out here right now do come out and get out here.
What is when you're looking ahead, and I know it's hard to plan too much in the future, but that's always kind of what you're doing, is planning for the future. What impact is this going to have on the university system as a whole?
Well, it's going to have an impact on our university system that's going to be significant from the standpoint of our finances. It's going to have an impact on the entire state. And keep in mind that out here in West Texas, we have all this stuff going on with COVID-19, but you also have this business going on between Saudi Arabia and Russia that has really made our oil prices plummet, and that is something that is fundamental to the financial health of the state. So I think that everybody, as we prepare for the next legislative session in January of 21, everybody's going to have to really think through what their priorities are going to be and how best to work this.
You know, I know you probably don't want to get too far out in front of the future and what it may mean as far as tuition goes, but if, you know, let's say we've got a parent out there who has a sophomore in high school and you know, that sophomore is looking at going to Texas Tech. You know, one question that's been asked to me a few times is what is this going to do to the price of tuition, not only at Texas Tech? I mean, you've got all universities impacted by this across the country. Is this something where we could see tuition prices escalate quickly?
You know what, Chad? Let me just tell you. I can tell you, and we meet daily. We have a phone conference every single day of the week, 7 days a week, with all of the presidents from all of our universities. And increasing tuition has not come up a single time. Now, we are looking at things around, what can we do to our overhead? Are there things that we can do with construction projects? Are there things that we can do with deferred maintenance that we can put it off for a year and save cash? But I can tell you that we've not even discussed at all raising student tuition. First and foremost right now, our primary objective is to make sure that all of our students, staff, and faculty are healthy and safe. And as we look toward the finances of things, I can tell you, and it's interesting that this is a question here because that's not even been part of the discussion.
Good. Well, that's a good thing. That'll probably make a lot of future students, current students, happy that hasn't been brought up. But before we get into coronavirus and the impact that Texas Tech is having as far as testing and everything else.
Sure.
Obviously people miss sports. We're done with the spring sports. The spring football game has been canceled. Has there been any talk about the upcoming football season?
No, the talk that we have had about the upcoming football season is to make sure that everything is good to go from that perspective. And because that's, as you know, when you roll into the football season, we have so many things that are cranking up simultaneously with that. But from the standpoint of athletics and our athletics department, the football season becomes a critical part of your financing for the athletic director's office for all the other sports. So I think right now, and now I have to put on my physician cap for just a minute when you talk about that.
Yes.
I do think that as we look at this with the things that we're currently focused on, we're really trying to, I would really expect that by summertime, we're in a position where we can be focused on the future and not just going this day-to-day thing that we're doing right now. So my expectation as a physician would be that by the fall, we're back in full swing with everything.
I'm going to ask you to keep that physician hat on for a little bit longer, Dr. Mitchell, and explain to folks the difference between what we're seeing with coronavirus and what you know about coronavirus. Sure. Compared to the flu, because that's I'm sure a question that gets brought up a lot with in the medical community from folks who are looking at going, how is this any worse than the flu? How is this any worse than a cold? Explain that for us.
Well, I'll tell you this, and I think the public needs to think about this two ways. The first thought process about this is we as a society, and I actually mean this pretty much worldwide, but certainly here in the United States, as a society, we really don't know how to deal with epidemics like this because our medical care over the past 100 years has been good enough that we have, to a large extent, been able to control our environment. And by that I mean control infectious agents for the most part. So if you go back 100 years ago in the United States, the three leading causes of death, number one, pneumonia and influenza. Number two, tuberculosis. Number three, infectious diarrhea. Now, people don't die from those things like that anymore because of things like antibiotics, vaccinations, et cetera, et cetera. So as a society, we're not used to dealing with these pandemics when they swing through. Our grandparents were actually exceptional at this because they were used to dealing with this kind of thing. And in fact, if you look at the word quarantine, the word itself is an Italian word from 40 giorni, which meant 40 days. During the plague in the 1400s, they figured out eventually that whatever was happening was being brought in on the ships. So they would make these ships in Italy sit in harbor for 40 days before they would allow them to come off. So our ancestors knew better how to treat this than we do. So there's that kind of public health perspective. When it comes to this particular virus, we actually know a lot about the coronavirus itself, the family of viruses, because they're a common cause of pulmonary infections, lung infections, but most of them are related to things like the common cold. With this particular virus, there's a few things about it that are different. Number one, the incubation period of this thing is we're having a hard time really fully pegging it down. It goes from anywhere from a day or two up to nearly 2 weeks, which means then somebody can contract the virus And then for the next couple of weeks, they can be either completely asymptomatic or just mildly symptomatic, and they're spreading the virus without even knowing they're doing so. So that's one of the things that's a big, big difference. The other thing is this virus tends to hang around for a good while on surfaces. So you can have somebody that goes into a store or goes into a place of business, goes into a classroom, whatever it may be, and if they leave, if they sneeze, or if they don't even have to sneeze, if they've wiped their face and they have a little bit of mucus on their hands, I know that sounds gross, but they put their hand on the table, then the virus can stay there from anywhere from a few hours to actually a few days. And so this is something different about this virus, is the way that it's kind of working its way perniciously through the population.
Visiting with the Chancellor of the Texas Tech University Systems. I've got about 2 minutes left here, Dr. Mitchell. Tell folks how Texas Tech is aiding in the testing or anything else that Texas
Sure.
Tech may be doing right now.
Well, we've actually taken one of our biological laboratories and we've converted it into a clinical laboratory so that we can perform the testing for this region for the coronavirus through nasal swabs. And so that lab is up and running, and we're working with all the local hospitals here, and we're actually working with hospitals all over the West Texas area to get the testing done. So that's a big thing that we've done. The other thing that we have a long history in is telemedicine. And one of the things that people are moving toward with this, and I think that one of the good things, if there is any good thing that's come out of something like this, would be looking at technology as a way to deliver care. As you know, that we've been one of the nation's leaders in telemedicine going all the way back to the 1980s, at a time when things were very low tech, and we've always had to do it because of the geography that we live in a way to push our ability to reach folks out. So telemedicine is a big thing that we're an expert in, that we're looking at as well.
Real quick before I let you go, if, and God forbid we would ever need this, if there aren't enough hospital beds in Lubbock, Texas, are dorms a possibility?
We're actually talking about dorms. The other thing to keep in mind, that we have one of the nation's best simulation training labs right here in Lubbock, and that simulation training lab that we use to teach physicians and nurses and other students, we could convert that to a live emergency room, ICU, delivery room, OR, quite literally overnight if we needed to.
Wow, that's very good stuff. Dr. Ted Mitchell, the Chancellor of the Texas Tech University Systems. Let's visit again soon as this continues here throughout the United States and here in Lubbock, and we appreciate you visiting with us today.
Thanks for having me, Chad. Take care.
Absolutely. That's Chancellor of the Texas Tech University Systems, Dr. Ted Mitchell, here on the Chad Hasty Show. We'll take our final break. When we come back, your phone calls and more.